In this video, I will help you to understand the interrelationships between pressure, flow, resistance, and help you to understand some of the mechanisms that your body uses to control and regulate blood pressure and blood flow. What is blood pressure? Well, blood pressure, when we talk about it in a clinical sense, like I took the patient's blood pressure and it was 120/80, what we really mean is the measurement that we got by squeezing a blood vessel until it's totally smashed shut, and then slowly releasing the pressure on the cuff and listening for when we lower the pressure to the point where it goes right here. What you're going to hear is a as blood starts to squirt through the opening. You don't hear it up here because we have squeezed the vessel shut, and so no blood is coming through. But as we call it bleeding off the pressure. It's probably not the best way to say it, but as we slowly let the pressure out of the cuff, when it reaches the point that matches the pressure of the blood squirting through, then we make a mental note. When did we start to hear these so-called Kortkoff sounds? Right, sort of sounds like an ultrasound. When we lower the pressure to the point that the vessel is totally open, it stops making the sound, and we make a mental note. Beyond that point, the vessel is totally open and then silent, right? So this sort of relates to what we talked about in the last chapter, with heart murmurs being abnormal valves or holes, allowing a little bit of turbulence. So what we want to see in our patients is something like this, or even lower, right? In a general sense, the lower your blood pressure, the easier it is for your heart to work, and the less potential damage you could be doing to your vessels, less chance of stroke or aneurysm, right? Can it be too low? Well, yeah, of course, and certainly that happens sometimes too, especially in our cardiac patients where they're in heart failure, right? The blood pressure can drop so low that it's hard for them to operate, hard for them to get around. They can't focus, or they're dizzy, they can't stand up, peripheral vascular issues. Anyway, so the point is, we want it to be somewhere in this ballpark. A little lower is better. If it's a little higher, that's not necessarily a bad thing, right? 120/80. What if it's 130/90 or 140/100? As these numbers go up just a little bit, the risk of all of those other things, like stroke, aneurysm, peripheral vascular injury, kidney damage, that all starts to go up. In cases where we see patients with pathologically high blood pressure, we're up in this range here, right? A systolic pressure above 200 is very dangerous, and usually the result of water retention, like we see in diabetics. They're going into kidney failure perhaps, and they're unable to get rid of that excess fluid, and so it builds up in the bloodstream, driving the pressure up into dangerously high territory up here where we could see a blood vessel burst, seizures, and just cardiac arrest, right? Because the heart is working so hard to push all of that fluid around that ultimately patients oftentimes, their heart just fails. They go into cardiac arrest and die. Wow, what a downer. Okay, moving along. We talked already about this in the last video, but if you need to pause here to read the details and really understand it, that's cool. If you're a visual learner, that's cool. Let's talk about viscosity. Viscosity is the thickness of the fluid, or technically the resistance of the fluid to flow. So water has low viscosity. It will flow very easily through a vessel. Blood has a higher viscosity. It's thicker than water, as they say, and it's true by physics. Viscosity is the resistance to that flow. So a very thick fluid like molasses has a ridiculously high viscosity, very difficult for it to flow. So how does this relate to blood? Well, as the viscosity increases, the pressure required to flow also increases. And we can see here a couple of different ways that we can change the thickness of our blood. Our blood is certainly thicker than water, and it's because, remember, it's this colloid, right? A colloid is a mixture with these non-dissolved particles in it, like red blood cells. And that's what this value is. Remember, hematocrit is the relative amount of red blood cells in a unit of, here it says percentage of total blood volume composed of red blood cells. So if you have more red blood cells, your blood will be thicker. If you're suffering from that type of anemia, where you don't have enough red blood cells, your blood will be thinner. And there are, of course, mechanisms of maintaining just the right thickness as it relates to your red blood cell count. You might think of erythropoiesis, right? If our blood is too thin, we're going to make more. If our blood is too thick, we're going to make less. And that definitely contributes to the viscosity of the blood. Dehydration is another big factor. In cases of very severe dehydration, there is literally less water in the blood, just like there would be anywhere else, and the blood becomes very thick, highly viscous. Here's your physics for the day, ladies and gentlemen. Look at this. Laplace, some French guy, undoubtedly. Laplace's law says the force acting on a blood vessel wall is proportional to the diameter of the vessel times the blood pressure. F equals D times P. So in the event that we have a very tiny vessel and very high pressure, we could see a really big force. But places where the vessel wall is thinner and more compliant, there's greater diameter. Given the same pressure, there will be less force. So how does that relate to pathology? Weakened parts of a vessel wall bulges out and is an aneurysm, right? So if you have high blood pressure and a weakened vessel, you could have that whole diameter really increase. This is the term I used, compliance. Vascular compliance, sort of like how stretchy is it? Think of a balloon. If you have one of these tiny little balloons, it can be really hard to blow up. It's not being cooperative or compliant. But if you have a big floppy balloon, it might be quite easy to inflate because it is much more compliant. We want our blood vessels to be a little compliant, right? As our blood volume increases to a certain part of the body, we want the blood vessels to respond to that and to increase in their capacity to carry that blood. We just don't want it to be too compliant, right? If it's too weak, it could result in an aneurysm. Good time to pause the video. Make sure you can describe these things here.